Warfarin is one of the most tested drugs in nursing exams, and today, you're going to master it. In this video, we're going through 30 of the most asked Warfarin MCQs. Grab your pen and paper, answer each question before I reveal the correct answer, and keep track of your score as we move along. And when you're done, drop your final score in the comments so we can see how you did. Let's get started. Which of the following best describes the pharmacologic classification of warfarin? A. Anticoagulant, B. Antiplatelet agent, C. Thrombolytic agent, D. Non-steroidal anti-inflammatory drug. Correct answer, A. Anticoagulant. Warfarin is an anticoagulant because it prevents blood clots from forming by interfering with the clotting factors produced in the liver. It does not act on platelets or break down existing clots. It works by slowing the blood's ability to clot, which is the defining action of anticoagulants. Warfarin exerts its therapeutic effect primarily by inhibiting which of the following? A. Platelet adhesion, B. Vitamin K-dependent clotting factor synthesis, C. Fibrin degradation, D. Calcium ion movement. Correct answer, B. Vitamin K-dependent clotting factor synthesis. Warfarin works by blocking vitamin K in the liver, which is essential for producing clotting factors 2, 7, 9, and 10. By reducing these clotting factors, warfarin slows blood clot formation, which is how it prevents dangerous clots. In patients receiving warfarin therapy for most indications, which of the following represents the recommended therapeutic INR range? A. 0.8 to 1.2, B. 1.5 to 2.0, C. 2.0 to 3.0, D. 4.5 to 6.0. Correct answer, C. 2.0 to 3.0. The INR, International Normalized Ratio, measures how long it takes blood to clot. For most patients on warfarin, an INR of 2.0 to 3.0 ensures blood is thin enough to prevent clots, but not so thin that it causes dangerous bleeding. Which of the following foods may decrease the anticoagulant effect of warfarin due to its high vitamin K content? A. Rice, B. Spinach, C. Apple, D. Fish. Correct answer, B. Spinach. Warfarin works by blocking vitamin K, so eating foods rich in vitamin K, like spinach, can counteract the drug's effect. High vitamin K intake may make blood clot faster, reducing warfarin's ability to prevent clots. A patient taking warfarin reports passing dark, tarry stools. This finding is most indicative of which condition? A. Constipation, B. Iron supplementation effect, C. Mild gastritis, D. Gastrointestinal bleeding. Correct answer, D. Gastrointestinal bleeding. Dark, tarry stools may indicate bleeding in the gastrointestinal tract. Because warfarin increases bleeding risk, this symptom requires immediate medical attention. Concomitant use of warfarin with which of the following medications is most likely to increase the risk of bleeding? A. Metformin, B. Ibuprofen, C. Insulin, D. Amlodipine. Correct answer, B. Ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory drug. It can irritate the stomach lining and interfere with platelet function. When combined with warfarin, the risk of bleeding significantly increases. Which of the following agents is used to reverse the anticoagulant effects of warfarin? A. Protamine sulfate, B. Vitamin K, C. Heparin, D. Calcium. Correct answer, B. Vitamin K. Vitamin K is the antidote for warfarin. It helps the liver resume production of clotting factors, thereby reversing the anticoagulant effect. Warfarin therapy is commonly prescribed to reduce the risk of thromboembolic stroke in patients diagnosed with which condition? A. Hypertension, B. Asthma, C. Atrial fibrillation, D. Epilepsy. Correct answer, C. Atrial fibrillation. Atrial fibrillation causes irregular heartbeats that can lead to blood clot formation in the heart. Warfarin helps prevent these clots and reduces the risk of stroke. Which instruction should the nurse provide to ensure optimal therapeutic consistency when taking warfarin? A. Take the medication at the same time each day. B. Take the medication only when symptoms occur. C. Take the medication twice daily. D. Take the medication every other day. Correct answer A. Take the medication at the same time each day. Taking warfarin at the same time daily maintains stable blood levels, ensuring consistent anticoagulation and reducing the risk of clot formation or bleeding. In which patient is warfarin considered contraindicated? A. A patient with deep vein thrombosis. B. A patient with a mechanical heart valve. C. A pregnant patient. Or D. A patient with atrial fibrillation. Correct answer C. A pregnant patient. Warfarin crosses the placenta and may cause fetal bleeding or congenital abnormalities. Alternative anticoagulants, such as heparin, are preferred during pregnancy. Which herbal supplement can potentiate the anticoagulant effect of warfarin? A. Iron. B. Ginkgo biloba. C. Vitamin D. Or D. Zinc. Correct answer B. Ginkgo biloba. Ginkgo biloba may increase bleeding risk when taken with warfarin. Patients should be counseled to avoid or use it with caution while on anticoagulants. If a patient misses a scheduled dose of warfarin, what is the recommended action? A. Take 2 doses the following day. B. Skip the missed dose permanently. C. Take a double dose immediately. Or D. Take the missed dose as soon as remembered on the same day. Correct answer D. Take the missed dose as soon as remembered on the same day. Doubling doses or skipping multiple doses can lead to unsafe fluctuations in anticoagulation. The correct approach is to take the missed dose promptly and then continue the regular schedule. What is the standard route of administration for warfarin? A. Intravenous. B. Intramuscular. C. Subcutaneous. D. Oral. Correct answer is D. Oral. Warfarin is usually taken by mouth for steady absorption and convenient daily dosing. Injectable forms are rarely used as oral administration is effective and easier for long-term therapy. Which of the following signs should be reported immediately by a patient taking warfarin? A. Occasional hiccups. B. Pink or reddish urine. C. Mild fatigue. D. Sneezing. Correct answer is B. Pink or reddish urine. Pink or reddish urine may indicate urinary tract bleeding, a serious complication of warfarin therapy. Any unexpected bleeding should be reported to prevent severe blood loss. Which antibiotic is most likely to interact with warfarin and increase bleeding risk? A. Ciprofloxacin. B. Amoxicillin. C. Penicillin. D. Cephalexin. Correct answer is A. Ciprofloxacin. Ciprofloxacin can enhance warfarin's anticoagulant effect, increasing the risk of bleeding. Patients on both medications require close INR monitoring. What is the primary therapeutic goal of warfarin in patients with deep vein thrombosis? A. Immediately dissolve existing clots. B. Increase blood circulation speed. C. Prevent further clot extension. D. Raise platelet count. Correct answer C. Prevent further clot extension. Warfarin does not dissolve existing clots. Its main goal is to prevent existing clots from growing and to reduce the risk of new clot formation, protecting the patient from complications like pulmonary embolism. Which laboratory test should be obtained before initiating warfarin therapy? A. PT-INR. B. Serum sodium. C. Blood glucose. D. Serum calcium. Correct answer A. PT-INR. A baseline PT-INR allows clinicians to determine an appropriate starting dose and safely monitor anticoagulant therapy. Which physical activity should be avoided by patients taking warfarin? A. Yoga. B. Walking. C. Contact sports. D. Swimming. Correct answer, C. Contact sports. Activities with high risk of trauma can lead to serious bleeding in patients on anticoagulants. Warfarin should not be administered to patients with which condition? A. Controlled hypertension. B. Diabetes mellitus. C. Hypothyroidism. Or D. Active bleeding. Correct answer, D. Active bleeding. Administering warfarin in the presence of active bleeding can worsen hemorrhage and lead to life-threatening complications. Which of the following is another name for warfarin? A. Heparin. B. Coumadin. C. Aspirin. Or D. Clopidogrel. Correct answer, B. Coumadin. Warfarin is commonly called Coumadin. Which drink can increase the blood-thinning effect of warfarin? A. Grapefruit juice. B. Milk. C. Water. Or D. Green tea. Correct answer, A. Grapefruit juice. Grapefruit juice can increase warfarin's effect and the risk of bleeding. Patients should avoid drinking large amounts. Which sign may indicate internal bleeding in a patient taking warfarin? A. Clear urine. B. Muscle cramps. C. Nosebleed. Or D. Severe abdominal pain. Correct answer, D. Severe abdominal pain. Severe abdominal pain may signal internal bleeding and requires immediate medical attention. What is a potential risk of taking warfarin during pregnancy? A. Large fetus. B. Hyperglycemia. C. Congenital abnormalities. Or D. Preterm labor only. Correct answer is C. Congenital abnormalities. Warfarin can cross the placenta and cause birth defects, so it is not safe during pregnancy. Which medication can reduce the effectiveness of warfarin? A. Aspirin. B. Heparin. C. Clopidogrel. Or D. Rifampin. Correct answer is D. Rifampin. Rifampin increases the breakdown of warfarin in the liver, reducing its anticoagulant effect and increasing clot risk. Warfarin inhibits the synthesis of which clotting factors? A. 8 and 9, B. 1 and 2, C. 2, 7, 9, and 10, or D. 11 and 12. Correct answer is C. 2, 7, 9, and 10. Warfarin blocks vitamin K-dependent clotting factors 2, 7, 9, and 10, which slows down blood clot formation. What is the most common side effect of warfarin? A. Fever. B. Hypertension. C. Hyperglycemia. Or D. Bleeding. Correct answer is D. Bleeding. Bleeding is the most frequent side effect. Patients should watch for bruises, nosebleeds, or blood in urine or stool. Which type of injection should generally be avoided in patients taking warfarin? A. Intramuscular injection. B. Intravenous injection. C. Subcutaneous injection. D. Intradermal injection. Correct answer is A. Intramuscular injection. IM injections can cause hematomas and excessive bleeding in patients on warfarin. Subcutaneous or IV injections are safer alternatives. Which vitamin can reverse the effect of warfarin? A. Vitamin A. B. Vitamin D. C. Vitamin C. D. Vitamin K. Correct answer is D. Vitamin K. Vitamin K restores clotting factor production and reverses warfarin's anticoagulant effect in cases of overdose or excessive bleeding. Why is warfarin often started together with heparin at the beginning of therapy? A. Warfarin acts immediately. B. Heparin is taken orally. C. Warfarin has a delayed onset of action. D. Heparin increases INR. Correct answer is C. Warfarin takes a few days to work. Heparin is given at the same time to prevent clots until warfarin becomes effective. What is the most serious complication associated with warfarin therapy? A. Infection. B. Hypertension. C. Constipation. D. Bleeding. Correct answer is D. Bleeding. Bleeding is the most serious risk of warfarin. Patients should watch for bruises, nosebleeds, blood in urine, or black stools and report them immediately. That's it for the 35 most asked warfarin nursing MCQs. So, how did you do? Drop your final score in the comments below. I want to see who's truly exam ready. If you found this helpful, don't forget to like the video, subscribe for more high-yield nursing MCQs, and share this with a friend who's preparing for exams. Keep practicing, keep improving, and I'll see you in the next one.